Periods and the menstrual cycle. Today we're talking about periods and the menstrual cycle. For some people, this can be a sensitive topic. My name is Mel Gadd and I'm a sex educator with Cwmni Addysg Cru Sex Education Company. So why are we talking about periods? Well, if you're female or assigned female at birth, you will probably start having periods during puberty, and this will be different ages for different people. You can have them for about 40 years from puberty to menopause, on average experiencing 450 periods during a lifetime. They can be an indicator of fertility, health and ill health, and the menstrual cycle can affect all parts of someone's life. You can seek help with managing heavy and painful periods, and some hormonal contraception can pause periods altogether. So what is a menstrual cycle? Well, a menstrual cycle is the time between the first day of your period through to the day before your next period. On average, a cycle lasts about 28 days, but it can vary from person to person. Your menstrual cycle encompasses all the stages your body goes through to prepare for a potential pregnancy, whether you're having sex or not, or trying for a baby or not. It involves physical and emotional changes. Some can be good and some can be more challenging in response to the differing levels of hormones being released. Understanding your cycle will help you manage these changes. Here's a really useful illustration of a menstrual cycle, showing how our hormone levels rise and fall during the cycle. Let's talk a bit more about the different phases. So initially we have the menstrual phase. This is day 1 to day 5. You're not pregnant, so your unfertilized egg and bloody uterine lining is not needed for a pregnancy. It is shed and comes out of your vagina. You are having your period. You may experience a range of physical and emotional symptoms, including cramping around your stomach and lower back, feeling sick, feeling very tired, and you might have an upset stomach. During this time and extending out of it is your follicular phase. So this is day 1 to day 12. So whilst you're having your period, your hormones are already preparing for your next ovulation, the release of an egg. After your period, your estrogen levels will start to rise and your uterine lining starts to thicken with blood again. You may feel like you have more energy and you're sleeping better. Then we have our ovulation phase, and this typically happens about day 13 to day 15. Your ovaries release an egg which starts to travel down the fallopian tube. You may have some cramping, and we call this ovulation pain, and you may have some spotting and breakthrough bleeding. You may notice that your vaginal discharge looks thinner, clearer, and is slippery and stretchy. We then have our luteal phase, and this is day 16 to day 28. Your egg is still travelling towards your uterus, and you increase production of estrogen and progesterone to prepare for a possible pregnancy. If the egg is not fertilized, your hormone levels fall and the uterine lining will start to break down. You may experience some premenstrual syndrome symptoms, such as mood swings, breast tenderness, skin changes, bloated stomach, sleep and appetite changes. You can use period products that are disposable. So you can get pads, and these are absorbent pads that stick into pants or knickers, and they're disposed of in a bin after use. And you can get tampons, which are absorbent plugs of cotton worn inside the vagina. They can be inserted into the vagina with an applicator or a finger, and then they're disposed of in a bin after a single use. And you can also get reusable period products. So here are a range of those. We can get period pants, period swimwear. These are washable items with absorbent gussets that you just pop in the washing machine. You can get washable pads, and these are reusable washable pads, and they have poppers to hold the pads in place. And again, they can be popped in the washing machine. And then we can have menstrual cups, which are soft silicone cups that are inserted inside the vagina to collect the blood, and these must be emptied regularly, and they're washable under a tap when you're using them throughout your period, and you can sterilize them every month. So what's considered a normal period? So periods usually start between age 8 and age 15, and they stop on average age 51. This is during menopause. For the first 2 years after periods start, the cycle may be irregular and it's typically between 21 and 45 days long. The first cycle is usually the longest. By the third year of having periods, most menstrual cycles are on average 28 days, but between 21 and 35 days is considered normal. After 2 to 3 years, the average period lasts about 5 days, but this can vary between 3 to 7 days. Bleeding is often heavier in the first few days of a period, and using 3 to 6 regular pads or tampons per day is considered normal. So when do we need to get checked out? What's not considered normal? So if you're 16 years old or older and your periods have not yet started, if after settling down a menstrual cycle is consistently shorter than 21 days or more than 35 days, or if your periods have stopped for 3 months or more and you're not pregnant or using hormonal contraception. If your bleeding is less than 2 days or greater than 7 days. Changing period products every 1 to 2 hours, particularly if bleeding lasts more than 7 days. Needing to use 2 period products at once, for example, a pad and period pants, or a tampon and a pad, or a menstrual cup and a pad. Frequently bleeding through your period products. Passing blood clots the size of a 10p coin or bigger, and your period stops you engaging in normal day-to-day activities. So what can help with premenstrual syndrome and period pain? Tracking your period so you're aware of when symptoms can occur. Taking painkillers such as paracetamol or ibuprofen, but not exceeding the dose. Exercise can release cramped muscles and reduce discomfort, and the endorphins released can help manage perception of pain. Orgasms can help too. Heat, so via a hot water bottle, a stick-on heat pad or warm bath or shower can help with the pain. And remember, if you've got heavy periods, eat enough iron-rich foods. So what else can help with heavy periods? So you can use over-the-counter anti-inflammatory painkillers such as ibuprofen. Remember, of course, not to exceed the stated dose. Visit your GP because you can get help with prescription medicines that help the blood clot or reduce inflammation, which reduces period bleeding. Hormonal medicine and hormonal contraceptives can help reduce or prevent bleeding altogether. The cause of the heavy bleeding can be investigated, and if you don't get the support you want or need, you can request to be seen by a different doctor. Endometriosis is a condition that affects 1 in 10 women and assigned female at birth people of childbearing age in the UK. It's not just period pain, it's a chronic inflammatory condition. It happens when womb-like tissue grows outside of the uterus. Endometriosis tissue responds to the menstrual hormones, which causes pain, inflammation, and scar tissue. It is more likely if you've got a family history of it. It's not contagious, it is not cancer, and it's not an STI. There is no cure currently, but diagnosis and treatment can help you manage your symptoms. Adenomyosis is when uterine tissue grows into the walls of the uterus, and it's often mistaken for endometriosis. It's possible to have both conditions at once. It causes heavy periods and painful periods. It can cause pain during sex and an enlarged uterus. There is no cure currently, but diagnosis and treatment can help you manage your symptoms. Polyendocrine metabolic ovarian syndrome, PMOS. This used to be called polycystic ovary syndrome, PCOS, until recently. It's a common condition. It causes irregular periods. It causes fluid-filled sac around your ovaries, but these are not actually cysts. It causes symptoms of excess of androgen hormones, such as growth of body hair and/or head hair thinning or loss, weight gain, acne, and fertility issues. There is no cure, but symptoms can be managed. Periods and sex. So you can have sex during your period, and some people find they have a higher libido or sex drive during their periods. Orgasms can help reduce period pain. Lay a towel on top of your sheets or furniture to help easy cleanup. Remember to remove tampons or cups before anything is inserted inside your vagina. If you find that having sex is painful during your period, you can take pain relief an hour before sex. And you can use cups or dams if you're having oral sex and want to reduce the blood that's present. Remember, you can still get pregnant if you're having penis and vagina sex during your period. So think about using condoms, making sure you have your contraception in place, and regular STI screening. For more information, you can have a look at these different websites. One day, your periods will stop. Your ovaries will start producing less estrogen and progesterone, and your fertility will start to gradually decline. This is called perimenopause. Perimenopause can last a few years. Your periods will eventually stop altogether, and this is menopause. On average, people are about 51 years old when they experience menopause. People can experience a wide range of physical and emotional symptoms when in perimenopause and menopause, and you can contact your GP for support. Some people are prescribed hormonal replacement therapy, HRT, to manage any unwanted symptoms. External and internal condoms, dams, lubricant, and STI test and post kits are all available for free from the Student Centre in the Students' Union and the accessible toilet in the Students' Union. You can also access the Student Wellbeing Service for any mental health and emotional support. They also give information on local services that are accessible by you. Your local health board is the Betty Cadwallader University Health Board. They provide all your local sexual health services, and you can find out more details about their services through this website or this QR code. Their services are confidential, easy access, friendly and not judgmental, and free. They can provide STI testing and treatment, contraception services, and HIV services. You can access further sexual health services through the Public Health Wales Sexual Health Wales website, and that you can access this through this website address and this QR code. They provide free test and post STI screening kits that you can order online to have delivered to wherever you want, free postal condoms, and a wide range of sexual health information. This is one of a series of video presentations on relationships and sexual health topics commissioned by Undeb Banga. They were designed and delivered by Cwmni Addysg Sex Education Company. The educational images used are copyright to Swirl Scotland. Thank you.